Hi, my name is Willis Summers, and today I will be teaching you about stress inoculation training and how it is used to treat PTSD. First, what is stress inoculation training? It is a cognitive behavioral therapy that is most often done in 90-minute sessions over several weeks. This means that it is most often done in a residential treatment facility. It can be done in group therapy sessions. However, it is most often done in one-on-one sessions because the relationship between the client and the therapist is extremely important to the treatment plan, as the therapist will be guiding the client through the treatment plan and creating a one-on-one personalized treatment plan for the client. As I just stated, your relationship with your therapist is extremely important, as they will help you become more aware of your triggers and cues for trauma-related fear and anxiety in your environment and around you. They will then help teach you coping skills that you can use to combat these negative feelings. The first is deep breathing from your diaphragm. The therapist will teach you how to deep breathe from your diaphragm, and then you will go and practice it outside of therapy so it becomes a habit and you don't have to think about it. You will then learn to silently talk to yourself and focus your internal talks on quickly recognizing negative thoughts about yourself, stopping them, and then changing them to positive, encouraging statements. You will also learn muscle relaxation training, in which you will learn to relax each muscle by tensing them and then releasing them individually. This is another thing you can practice outside of therapy, so it's natural and is a habit. You will then go on to role play, in which you and your therapist will create a anxiety-provoking situation, and you will role play coping using the skills you learned. Another version of role-playing is thinking about and changing negative behaviors, in which you use your imagination to practice effective coping, and your therapist guides you through a scenario in which you have encountered an anxiety-provoking situation and practice identifying trauma-related cues and discuss what actions you would take to prevent things getting out of control in the moment. These are all things that are really important to practice, as in the moment of fear and anxiety, it is hard to remember these coping skills. So getting them down to a habit and to just naturally relying on these skills, you will then not have to think about it in the moment of fear and anxiety. The goal is for you to resort to those skills without having to think about it in the moment, that it just becomes a natural thing for you. I am now briefly going to discuss a study done to examine stress inoculation training outcomes among veterans with post-traumatic stress disorder and traumatic brain injury. The study included program development and evaluation archival analysis of 65 veterans doing stress inoculation training over the period of 18 months. The veterans conducted baseline reports of PTSD, depression, substance abuse, and perceived performance. Paired samples of t-tests were used to evaluate pre- to post-treatment gains, and significant reductions in PTSD and depression were found. They also found increased some aspects of perceived stress tolerance and performance, and improvements in social and occupational functioning. There was an 88% follow-through of participants in the study. So through this study, it was found that there were dramatic reductions in anxiety and depression and stress in the veterans through the treatment process of stress inoculation training. Why don't we head down the hall towards the theater, where I can show you a brief clip of Dr. Donald Meichenbaum discussing stress inoculation training. His video will discuss what I've said so far, but also elaborate a bit more.
Stress inoculation and its variations has emerged as one of the key treatment modalities for people who have anger and aggressive problems. It's now been employed with combat vets, with prisoners, with adolescent offenders, and there are a number of analog studies with college students. It's been applied to people who have rage, driving rage, and so. And this is California. Come on, where else is this kind of treatment needed? The stress inoculation has three components. Okay, the first component is to develop a therapeutic alliance and conduct psychoeducation. It is to design to develop a supportive relationship where you can do collaborative goal setting, where you can educate people about the triggers, the emotions, the cognitions, the thinking processes, the behavior, and how they get caught up in that. It isn't like you do education and you do treatment. These are highly intertwined. Not only that, the treatment tries to include both assessment and treatment together. So it's not like you do assessment and then you do treatment. You're going to have collaborative goals that you're going to assess on a regular basis. So the first part of this stress inoculation training has to do with the education of the client and significant others. The second is the skills application. And sometimes people bring in skills. So you're going to collaborate with them to learn a variety of skills to break this vicious cycle of how to appraise events, how to conduct some control, to develop control on emotional self-regulation, whether these are relaxation to dampen the arousal, whether it has to do with acceptance kinds of strategies, whether it's cognitive restructuring. So we're going to teach skills that focus in on emotionality, that focus in on cognition, and that focus in on behavioral elements. The third phase, which is really critical, is application training. You want to make the training as similar to the real life situation as possible. So one of the things that becomes really interesting is that we can have rehearsal within the session. We can use imagery rehearsal. We can have graded in vivo exposure. We can get you to perform personal experiments. In fact, if you stay with the concept of inoculation, like a medical inoculation, you can actually see the degree to which an individual can be exposed to lower doses of provocations and learn coping skills. This could be done both on a treatment basis and on a preventative basis. So if you go to the Melissa Institute website, you can read about how stress inoculation training has been used in the Israeli Defense Forces, with soldiers, with policemen. So think about people who have to deal with this on a day-to-day basis. And what is it that you would like those individuals to do, both at an individual and group level, in order to notice, to catch, to interrupt that behavioral cycle?
Thank you for listening, and I hope you learned something about stress inoculation training and how it treats PTSD. It is an intensive treatment plan, so it's hard to use in your day to day life. However, using coping skills such as deep breathing, muscle relaxation, and positive self talk can be helpful in your day to day life, as well as spreading awareness of these skills to others can be helpful for them as well. It's important to practice these skills and have them on hand so that in the moment of fear and anxiety and stress, you don't have to think about which skill to use or how to use it. It just comes naturally. Here are my resources I used. Thank you again, and I hope you have a wonderful trip home.